Okay, well, I came to UCSD only a few years ago. I was a professor first at Georgia Tech, went there in 1995 after getting a PhD at University of Washington in 93. And then about 8 years later, I moved to Vancouver and was a Bombardier Chair holder in sustainable transportation. That was a split appointment in the end. It was moved around a bit, but I've had a joint half planning, half public health, two different deans, two different budgets, and all that for 18 years. And finally moved to San Diego about 3 years ago, right in the middle of the pandemic. So I'm going to talk a little bit about how the physical design of the places that we live, work, and play affect our not only our health, but how we get around, and which affects our health, but also that affects the environment in good or bad ways, and our own health and economics. So we're in a federally very strong period of time right now for infrastructure funding. As we all know, the call to action to promote walking, federal government initiative was in place to support environmental justice. Justice 40 under Biden was really, I think, one of the first executive orders, but very unclearly defined. Some of you probably have worked extensively on pieces of legislation or other aspects of things that led to some of the federal programs that we now have. But the Code of Federal Regulations, which I understand through my work through EPA, a lot of my work's been funded by the US EPA recently. The goals get operationalized through code, and the Code of Federal Regulations is what does that. And my understanding is that the goal of 40% overall of benefits should be invested into disadvantaged communities hasn't really been as carefully measured yet as we might want it to be to ensure the funds are going to underserved and overburdened communities, those impacted by air pollution and climate change, and are affecting health. Barbara, you asked a little bit about ways to weave in the housing crisis. Well, one thing that in California and the rest of the country is facing is, of course, where do you house or give homes to people? Where's the most cost effective, but not really singularly cost only, looking at the benefit. And the cheapest land, of course, is in the most undesirable, unhealthy places. And that's something we haven't really figured out that well yet. And the kind of research that I and others do in this area can help us get at more holistic or more complete answers to the cost, the true costs when you house people in an area that's subject to tremendous amounts of air pollution, noise, and other ill things for their health. Those health costs, of course, surface, and we pay for them one way. We end up having the economic impacts that are externalized from those initial decisions. So the Surgeon General's call to action was in 2015, and it initiated, this is 8 years ago, Step It Up. I started working on this topic in 1988. I was the first. There's no doubt about it. It just was, it occurred, it wasn't clear, I would say, immediately where I was heading on the health piece, but most research in transportation had only been vehicular based. And if anything, there was a little bit of work on public transportation. Most of the research was on how much people drive and maybe a little bit on how to get them to use transit. Nobody was studying walking. I was even told by, not to do this, that it would ruin my career. And this was about 1991 or two. I was starting to present my first papers at conferences, and there was a lot of like, oh God, this guy's going to talk about walking. People would like get it, this is at the National Academy of Science Transportation Research Board conference, and people were like laughing. And then, I thought, well, I think I'm good. I didn't pay attention to that. I knew that it mattered. And then the Surgeon General came out with a report that sedentary lifestyles and the need for moderate physical activity was what we really need to focus on. So been at this a long time. I wrote a couple books with the Centers for Disease Control leads, environmental health leads, urban sprawl and public health, and health and community design. That was back in the late 90s, early 2000s. So when we talk about technology and behavior, they go together clearly on the climate change side. And the question of, is it going to be, how far can we dig our way out through technology? And we're still in San Diego, really, really burdened with a very disparate, very frustrating political environment that's actually quite behind most other regions in North America. We are way behind every other region in California when it comes to understanding the need for development patterns that don't require 2 tons of metal to get a loaf of bread. We're not good at that. We need our 2 tons of metal to get or a 1 ton, 1.5 ton car to do anything. And people haven't really, even in Atlanta, where I was working 25 years ago, they've really advanced some on this. It's certainly far from perfect, but we're really stuck really far in the past. And it looks worse than ever before in the political landscape at the regional level. So when we talk about climate change, and the state has very progressive policies, the federal government does. San Diego's never had a conforming plan, I think, for maybe it does right now for a brief period of time, but it hasn't been able to really produce and stick with anything that will get us towards the trajectory that we would need to go to comply. Fuel mix and vehicle efficiency are the ways we get cars to produce the least amount of GHG emissions. Of course, that gets us so far, but we effectively have to deal with how people get around and demand, and that requires other modes of travel. So climate change and public health are a bit of two sides of the same coin. Reappropriating road space, taking back the streets. This is something that started to happen during COVID. I know that you're all interested in how can we leverage the results of the pandemic and other crises that we're facing to really turn this around. I'll talk a bit more about that. I can demonstrate through research and others in this area of research that I'm in as well. We can help put some numbers and document how much a reduction in GHG emissions would you get by developing X amount more dense development or housing, 30% versus 20% or 10% of the population in places where they can walk or use transit or bike. What's the economic return on investment or GHG reduction from building out the bike system, actually developing and connecting transit stations with bike active transportation infrastructure, cycling and pedestrian, and other types of modes of travel. We have, based on past experience and comparing places that do and don't do these kinds of improvements, there's data. And we can put those into predictive models, which is what I do. And then we can run that on future reinvestment scenarios. And it costs X amount more to take a downtown Gaslamp Promenade and redevelop it in a way that would be more sustainable. Well, that cost is borne on the front end and the benefits take time to accrue. So that requires more creative funding mechanisms to patient money to be able to do that. So here's just a couple examples. There are some cracks in the automobile armature in San Diego and in the rest of North America for sure. One of them, of course, is the receptivity that the public demonstrated during the pandemic to having pedestrian and active transportation infrastructure, to having road space reallocated in their community. Never before was that even considered viable. So to take a lane and put bike lanes in would have never, been permitted. The public response initially to the bike lanes, 4th and 5th, for example, coming up onto Bankers Hill from downtown, those have received, mixed reviews. I run into people all the time who are hate them, because there's cyclists around that they have to now contend with, or that they feel it took away precious parking. But these are growing pains, and there's no way around it. We're going to have to find other ways to get around that are less energy intensive. Even if we think that, you electrify, of course, the electricity needs to come from somewhere. Yes, some of it can be or hopefully a lot of it could be solar powered, but we still end up with some of it being generated through unsustainable energy sources. And most of all, we end up with a sedentary lifestyle. And there you go back at the health piece. And there's no way around that. So the 2021 Infrastructure Investment and Jobs Act, $2 trillion, was a reauthorization of transportation spending plus increases in equity-driven and clean energy solutions. And UCSD is clearly immersed in a lot of research on topics. NSF has been funding lots of research and across campus. You see many studies underway identifying new technologies and solutions, repair and rebuild our transportation infrastructure so it's affects equity and safety and of course resilience and improve transportation options for millions. It is a massive program, of course. And you can see on the right below the picture, repair what's there, multimodal access. So, walk, bike, transit, and drive modes, more integrated in a more seamless way. Safety for active modes, and ensure, most of all, investment in underserved and vulnerable communities. So this graphic is one that I published in 2019, and I felt I use it constantly. I use it to describe to clients when I'm consulting, working for jurisdictions, government agencies, or developers. How does this research work? On the left are 4 different aspects of the environment that are manipulated through different policy decisions. Transportation infrastructure, just talked a bit about that. Land use, walkability, the pedestrian environment, but also in pedestrian environment, which is a smaller scale. Land use and walkability, back up to this one, is about density, compactness, the debate around densifying around transit stations. That's a big issue in my neighborhood, and I think it's where Barbara lives as well, Mission Hills. Lots of contentious debates around having these taller towers with no parking, and then of course the regulatory environment, which is coming down from the state, I believe, that put into policy, which is new. The state is actually getting very into land use regulation, which has historically been allocated to local governments through incorporation. Cities and counties are granted the local home rule. But the state of California has gotten very creative and realizes that they need to provide leadership. It's not happening. And building transit will be useless and not have much effect if we cannot densify around transit. So there's then this question around how to enable and sustain a car-dependent lifestyle. And there needs to be some happy mediums in there with some allowance for driving and some parking, but also better connections from neighborhoods like Mission Hills down to the trolley line that it still needs to be improved. And we in San Diego have significant issues to contend with because of our topography, with the mesas, the canyons, and the coastal plains elevation shift. So pedestrian environment is really important. Seating, lightings, street furniture, good sidewalks, connected signalized intersections, trees, and all of that really matter for whether or not people are going to walk. And if they're more sensitive to the environment, that matters all the more. Finally, green space. Very important, having green infrastructure and trees and tree canopy. All of these factors affect travel and activity patterns, which affect behaviors and exposures. Behaviors and exposures are in many forms: diet, physical activity, social interaction, exposure to air pollution, traffic safety and crime, noise. These interact through space and time to affect our biology, our weight, inflammation, and stress, which interact with one another yet again. So you can have environments that could be quite walkable, but the air pollution exposure is quite high, such as a place where you might put affordable housing along a very busy, dense street, which may not be as appealing as 2 streets back from a major transportation corridor. So we see, and then that air pollution exposure even though somebody's walking more, may cause systemic inflammation that leads to diabetes. So there's confirmatory evidence. Some of you may work in this area. We certainly have a lot of expertise at UCSD on this topic, but basically there's a lot of evidence on how different environmental pathways and exposures through inflammation and stress and weight affect our physical and mental health. And then the question that comes at the end is what are the economic, wellness, of course, most importantly, and for whom? Where are the benefits and burdens distributed systematically across society for the most underserved and disadvantaged that are living in places that are poor access, perhaps even car dependent with bad transit, without good tree canopy, exposed to extreme heat, lack of destinations nearby, requiring a lot of sedentary travel to get around in highly polluting cars. Anyways, we have these patterns. And so the research that in this area that I try to do with my colleagues and students and staff is to develop tools that can be used by end user decision makers in as applied of a manner as possible, while contributing to the theoretical and evidence base. So here's the three levels of the physical environment, macro and micro. Within macro is the regional accessibility. When we added the Blue Line trolley, we were adding transportation accessibility, transit accessibility in this case, which affects the relative travel time between transit and driving. And of course, makes walking more appealing because it concentrates access in given locations where car and automobile investment distributes accessibility more broadly in an even kind of a plane. So complete communities is live, work, play, having destinations near where, shops and services near where you live and where you work, and perhaps even being able to live near where you work. That is the definition of a complete community. And also having grocery stores. There's been a lot of work on what a complete community is. It remains a strong topic in this area of research. The 10-minute neighborhood or 10-minute city or community, grocery store, having an anchor, critical. Then back to the pedestrian environment, just to remind you that these are now through digital images, Google Street View, which has been photographing our entire world, most of it, certainly all the Western world and on into other countries, Google has been cataloging through digital images the presence or absence of features of the physical environment while they're just taking photographs. We're now able, my colleagues and I, to extract these features from photographs using artificial intelligence and then using these features to determine, so how much more likely is a person to walk on the right if they live in a neighborhood that may be Georgetown or somewhere that's pretty walkable, but now there's seating. What's the incremental value added? Seating's pretty cheap. If it makes a health difference for an entire population living there, it may very well have one of the best cost-benefit ratios that anybody's ever seen when it comes to government and intervention. So measurement and precision, what you can get to matters. This whole field started, only a few years ago. Obviously, work in the late 80s that I did was early, or the first of the first studies. And we started with, knowing in my dissertation back in 1988 when I started, it was census geography, like most of us, many of it. We didn't have observation specific, address information, and we didn't have all the advanced GIS. In fact, we had maps. So I happened to get lucky. I found somebody in Seattle in King County where I was going to school, a guy named Mike Quinn. I don't know why I remember his name, but he had put a field in the parcel registry, the tax base data. Of course, parcel data everywhere has it. It's our tax information. And if you own a home, of course, you get all the different attributes of your home, the square footage, and various other things. But some parcels are commercial, retail, some are office space, some parcels are in park space. So that land use data, the parcel data, is how I built the first parcel level cadastral information system. But I still didn't know, I only knew where people, what census tract they were in. So at a census tract level of geography or scale, and that means you're subject to the modifiable aerial unit problem. You don't know if the person's down in the lower left corner, I didn't know where in the census tract they were. Confidentiality prohibited me to know that. But this is still a problem in this area of research today. Unless you move to one of these methods, which is what we've been doing through all the years. We had numerous NIH funded grants over about 5 to maybe 7 R01s or observational studies where we've been building the science, maybe even more than that. So here's an address of an individual. You grow a 1 kilometer network buffer. So if they walk out the door of their house, here is where they can get to on the road network. And we then attach the parcels to their buffer, and we measure the distribution of land uses, how evenly mixed is this space. So is there retail, is there residential, multifamily, single family, MFSF, civic, and you get the idea. So the most evenly mixed area around your home, we would theoretically assume means you would walk the most or drive the least distance. It's the most heterogeneous. Live, work, play is all there. I just want to point out this red squiggly line. This was along the way to getting to the network buffer. We did this. We could approximate with an address the amoeba-like shape of their 1 kilometer network environment. We hadn't gotten GIS developed enough to attach parcels to the accessible road network upon which we move. And just before that, after we got away from census geography, we were able to do these network crowfly buffers. So the first thing was the crowfly buffer, then we got to these network amoebas, and now down to the actual network buffer. So in the interest of helping people understand what the research is, I work a lot where government agencies and staff need to be able to explain to the average person what this stuff is about. So that's what I try very hard to make some graphics or pictures compared to those in the most car dependent, somewhat walkable, moderately walkable, and walkable environments. We're able to see aerial and street level images of these types of environments. This is basically quintiling 5 different typologies from the most car to the most car dependent to the most walkable environments. And I did this in Vancouver. We could do this for San Diego. Everything's bucketed into 5 bins. Compared to those in the most car dependent environments, those in a moderately walkable area were 27% less likely, and those in the most walkable, almost 40% less likely to develop diabetes. This is cross-sectional observational data, basically where we just literally compared the differential. So that, of course, is not longitudinal. It's not causal. It's absorbing self-selection where people who want to walk, who have predisposition for healthier lifestyles, are living in environment, have chosen to live in environments to the degree that they can and afford it, which is now more difficult, exhibit better health outcomes, at least in terms of diabetes. Overall, in the general population. Sense of community is greater in the moderately to the most walkable environments as well. And we can theorize why that might be. It could possibly be a function of running into your neighbors regularly rather than being in a car. It could also be a function of other factors. So in this area of research, we do our best to design, when given the luxury of primary data collection, we control for self-selection and attitudinal predisposition all the time in every way possible. But that doesn't actually really, if there is a latent demand for people to live in a more walkable environment that they can't afford or doesn't exist because it's undersupplied, we are actually preventing people from exhibiting and expressing what would be a healthy desire to actually be less car dependent. And that's something we're very good at doing and doing a whole lot of right now. So if it's self-selection and attitudinal predisposition that shapes the behavior, or physical environment itself and how the two go together, as a researcher who's been studying it for a third of a century, I don't care. It doesn't really matter. If it disabling or forcing people to live in environments or making it more economically rational to choose environments for every reason possible that are less healthy for them and for the environment is something that we are now currently very deeply entrenched within. So now moving on to, let me ask, stop for a moment. Am I audible?
Yes, you are. Yes, you are.
Thank you, Barbara. Any questions right now, or should I just blast on? I'll keep going.
Usually we save questions to the end,
Good.
and then we ask that people put them in the chat so we can monitor and
Okay.
consolidate if need be. We were started a few minutes late, so we'd like to end by about 4:45 or 4:50 at the latest, so we at least have 10 minutes for questions.
I'll be able to end earlier than that.
Okay, wonderful.
So when I was in Vancouver, the city of Vancouver is very progressive in this area. Maybe the most in North America, or certainly one of the top few regions. So this area of research was, pretty fun to do there because they were all over it. They in fact, they didn't even need the research. They were like, we're going to take this street in downtown Vancouver and we're going to turn it into a greenway. We want you to do a study on it. We'll pay you to do a study on it. And then we'll learn afterwards. We've already made a decision to do the greenway. We'll learn if it worked. It was sort of the opposite, where the government was actually pulling, forward and saying, we're going to do this. We have the political will. We know it's the right thing to do. Every other street in downtown is allocated to the car. Why can't we take one street and make it designated for bikes and pedestrians? So they picked this one street. And we did a before and after case control. So here's our sampling. You can see this is, we sampled within 600 meters, 0.6 of a kilometer from the corridor. We tried to be a half a kilometer away based on half a kilometer and a quarter, roughly quarter to half a mile, how far somebody would walk. So here's our controls. We learned in the study actually that the distance of impact, the distance decay, was 300 meters or about 3 blocks. 3 blocks back constituted what became our sample of impacted, or these are our cases and a test group, and then the controls are further away. The controls were between 600, 300 to 600 meters, and we had about 524 total, evenly distributed. So we learned a lot. This is what it looked like beforehand. It was extremely walkable, beautiful. But afterwards, it's still, the right of way is still devoted to the car. This is the same place. It's actually the same. If you look at this house, it actually is the same block. I didn't realize it until recently because it's so different. But, now driving has been, the road space has been reallocated. It is now a bike and pedestrian corridor. We learned a lot, and this is causal. Those within 300 meters of the greenway reduced their transport-related GHG emissions by 21%, whereas those further away actually drove more after the greenway was built because car sharing went into effect in this extremely walkable area. So people living in downtown Vancouver, when car sharing came along, most people living there didn't own cars. So their access to cars was very low. They'd already traded that off. And they were willing to pay to live, in downtown where everything's easy and accessible. But when you bring car sharing into the picture, they were like, I'll drive because it's now easier. So in this geography, car sharing, counter to many other places, car sharing actually encouraged more driving. But the greenway itself had a protective effect. People still drove less. The Those within, those close to the Greenway were twice as likely to meet recommended physical activity levels, whereas those further away became less likely to meet the target. I think also because of the car sharing. And then the most recent study we did was biking. And we showed a significant increase for those within short distance to the Greenway. Long before all of this, 20 years earlier, well, actually maybe 10 years before that, those studies, or 15 years before those studies were done, I just did I used to use the simple cross tabulation back to cross-sectional data, but it was effective and helped people see, objectively, how much are people driving based on in relation to where they live. And what you see here on the upper left is, sure, where it's denser, they drive less. We knew that, but how much? We maybe didn't know. So quite a bit. And you can see, but the research is complicated because what's on the left is not as centrally located. So you have regional location and accessibility also affecting GHG emissions. This is all GHG, number of retail, how many destinations in your neighborhood, and this suggests that there might be some nonlinearity. Pretty clumpy data. It was quartile. So we don't know exactly what that smoothing function might actually be. And then connectivity, intersections per acre. What that captures is route directness. How easy is it to travel directly from one destination to another? A gridded road network is the most connected, and cul-de-sacs are the least, and intentionally designed to be so. So we've taken, and this is years ago, this was for Seattle, King County. Ron Sims, who was the King County executive, head of King County, where Seattle's located, hired me and my team to do a study to develop a impact fee system that would be used to assess developers based on the predicted amount of greenhouse gas emissions their projects would generate. And by and large, the location of where their development would go was the main predictor. So we took into account all of the same land use measures I mentioned, the walkability factors. There's one here, retail FAR, which I should explain. It is the ratio of land area, of building area to land area. A high FAR, many of you I'm sure know this, a high floor area ratio, FAR, indicates that a building is right up to the curb and fills the building envelope, and it's many stories. That means there's not a lot of parking, not a lot of surface parking. It is the opposite of Mission Valley. Mission Valley's low FAR. You got a lot of surface parking and a lot of structured parking. In fact, Mission Valley is sort of evolving. It's not the lowest FAR. We have probably, lower floor area ratios in less valuable lands where land is less valuable. Mission Valley is getting to be quite central and probably going to be a very interesting redevelopment. It will be. What happens there is going to be important. It's already got a rail line, and it's got the river there, and it has a lot of potential. And the way it's currently developed is not going to last. It's not its best use in many areas. Some of it probably will remain, but a lot of it's going to change. So this is just, a predictive model. At the same time, the San Joaquin Air District came up with a law in California called the indirect source rule. And I was hired, this is going way back, as an expert to help combat what was basically the developers of the state of California jointly formed a lawsuit to challenge the state for allowing the indirect source rule, the air district, to penalize developers for developing large swaths of land away from anything else. And of course, that led to an awareness and an increased understanding of the critical importance of where development goes. And the indirect source rule was retained, and it was upheld and enabled to continue. And they've, I think, still continue to use it to this day. What it does is it assesses developers for the predicted air pollution costs of their development, and then uses the money to invest in other things if the development's going to take place in an outlying area and generate a lot of GHG emissions and vehicle miles traveled, then the money is assessed from the developer to do other things that would reduce air pollution. So this was a kind of a result of a study that we did when we were working in Seattle and King County. We were asked, what would it take to reduce? I talked about, you can reduce GHG emissions, greenhouse gas emissions by making vehicles more efficient. You can make fuels cleaner or more efficient, burn cleaner, or you have to deal with demand. So what we learned was if and when the average car gets 47 miles per gallon, we're not even there yet. We did this study finished it in 2005. So we're 20 years later, and we're not even at major progress, let alone technology breakthrough. So if we can lean more heavily on technology, the trade-off is that you can drive more. So if we got to 61 miles per gallon and we got vehicle fuels to be 65% more efficient, people could drive 21 miles a day on average. The current average is 25 in the Seattle, King County area, and I believe it would be higher in San Diego, the average. Just as an aside, in Atlanta, the average person, when I lived there, drove 43 miles per day. Population was right at about 4 million, which meant that every single day, people drove collectively further than the 120 to 130 million miles a day, which is further than the distance to the sun, and that's in a day. So I tell my students, don't worry when someone says you're too progressive or you're we're never going to change. What you're thinking is ludicrous because we live in cars, people love their cars, and I point them to that statistic sometimes and say what we do and accept as normal is profoundly bizarre, and our attitude about it is we've sheltered ourselves into making ourselves think it's normal. So there's a lot of ways to monetize. Now about the money. Methods for this is something I've focused a lot on. Hassan Akrada was brought into San Diego to be the head of Sandag. He was recently, I guess he finally chose to resign. That was not a great day for our region. He ran the Los Angeles' Metropolitan Planning Organization, which is the federal designated organization for transportation funding. He was brought in to take over and run Sandag. It was a very challenging thing for him to do, and he took the job on with great enthusiasm and was unable to affect change in the San Diego region. And that recently happened. Many of you may know that. He hired me in 2018 in LA to do a study, or actually 2017, to do a study to document the health benefits, the economic related health benefits of their active transportation funding. Los Angeles, and I think most every other region on the West Coast, perhaps except one, have bond initiatives. The public have supported and voted for funding to build transit and active transportation further, partly using charges that are not even allowed to be discussed any longer by staff in San Diego. So anyways, Hassan hired us to monetize the benefits of active transportation from a health perspective, and we've done many studies since then. So value of statistical life, of course, mortality is an important way to think about it, economic value of life. My work, and since about 2010, when I did an earlier study I was hired by American Public Health Association to do what was called to write a report on the hidden health cost of transportation. And we did use a mortality-based model for that very first study that was very widely distributed. But since then, we've been looking at cost of illness and morbidity, and I'll talk a little bit more about that. Cost of illness is national cost attributable to a disease elevates health is an important active transport co-benefit. Direct costs, there's direct and indirect. Direct costs are money exchanged for healthcare, whereas indirect costs get at absenteeism, workforce productivity, early disability, and then reduced productivity of those with more disease, more work miss, more disability, and increased mortality, bringing in, I guess, the mortality side of it to some extent. So we've been really focused on this topic, and I'm trying to kind of get a lot of the studies. I've done many written up into a collective piece of work. So I thought I would mention that, and then that all trips, of course, how do we effectively integrate health and climate change, because they are so interrelated, and the environment can have a benefit or a disbenefit or a cost for both health and climate change can be the same or different. So I wrote a study. This was one back in 2010. I guess this got published in Preventive Medicine, where I came up with this idea of an energy, what I call it, transportation energy index. And the index is based on every day we get around a certain amount on our own, human and active, versus sedentary vehicle expenditure. Well, that activity, and this graphic actually got a little edited just before my apparently, but it's a ratio. So the higher your ratio is, the more active travel, and the lower your sedentary energy, the better theoretically you would be for health and the environment. Well, there's 4 different possible quadrants. People that are highly, so this is highly active, are on the right. So this is the level of active travel, is the left, is the east-west or left to right. And high vehicular travel is top to bottom. So the winner, the ideal situation is finding the environmental influences, features of the environment that get people to be the most active with their travel while being while generating the least amount of using the least amount of energy for sedentary travel. So that's been something I've been focused on for a while, and I think there's something in this, because not only does it create one metric, it integrates and synthesizes 2 different enormous policy arenas that are maybe 2 of the biggest, well, they are definitely 2 of the biggest wicked kind of problems that we have. And when we recently were hired, for example, by Sacramento's regional planning agency, hired me to do a study on their long-range plan. We're working on it right now. Sacramento Council of Governments is the equivalent of SANDAG. So in their deliberations, we ended up with a lot of discussion around the public feeling that living in an outlying area where they charge their electric cars, and then when they get home, they're physically active for recreational purposes, ought to solve both the climate change and health problem. And it doesn't, because the amount of sedentary time in cars is definitely adverse to health, and you still end up with a lot of carbon being generated and energy used for sedentary travel. And you don't get as much active travel if it's purely recreational and not utilitarian, used to get around on a daily basis to destinations and accomplishing things you need to do. So, anyways, this is it's all about energy, and I'll let you read that. But lots of different ways that food and our food environment integrates with this. I'm going to wrap up in a few minutes. But basically, I've spent a lot of time applying the research. I've built what's known as the National Public Health Assessment Model with my colleagues. The purpose is to address a major gap in uniform health outcome measurement. It is a tool to forecast future health conditions. It's been used in 13 regions in North America and growing. It was developed, I built it 15 years ago in a consulting company that I've owned, Urban Design for Health. and it's been supported by the US EPA. And it's been a way to apply the research that I've been doing inside academia to the decision making in more of a consulting kind of an environment. So gotten a little bit familiar with that, but the bigger research volume and everything has remained an academic enterprise. So a lot of environmental indicators. It's also been funded by the Robert Wood Johnson Foundation, and measures and optimizes health and economic impacts of places. This is where the National Public Health Assessment Model, it's actually, we got a Kansas dot now, so there's 13. It's been used mostly for long-range transportation planning, that's kind of one of the focuses so far. The model takes geospatial input, demographics, 35 different metrics, different built and natural environment metrics, imports them into a statistical, spatially registered environment where it's spatially joined with health outcome data. And then the outputs include we were able to predict all of these things at the census block group level for the entire country. We have coverages, and the model can be used anywhere. A lot of indices. These measures are statistically all correlated, so we have to create indices to get at the spatial autocorrelation and other factors, drawing upon data from American Community Survey and built-in natural environment databases that we've been developing. We actually build the Smart Location database for the US EPA, which is a primary input, the walkability metrics for the country. Health outcomes, California Health Interview Survey, really large, really great data set. We've been able to access and get census block group address locations for the participants in our state surveillance system. So we build the tool off of California data and generalize nationally. I have way more than I think you're going to want to hear. So, but basically, lots of statistical model development. This is sort of some of the inputs. Talking to Sandag about using it again. It was actually originally built. One of the first early versions of it was for Sandag. That did not go well. It did not make their planning look, it showed not only was the plan that they were being sued on by many agencies for GHG failure of compliance with SB 375, it showed that it also would have tremendous adverse health impacts. So they really didn't. Their leadership didn't like the tool that they funded us to build. They got federal EPA dollars from Obama, and we moved on to the state of California and nation. So anyways, a little bit, I think this is maybe the last slide. Here's Chicago, and it just sort of shows the kinds of outputs that this tool can make readily available for planners to inform decision making. Maybe I'll stop here after showing this one. So this is the first, and I see Rick Bolin has a question, raised his hand, so I can see that. Is San Diego, when we did the project for Sandag, we were asked to model and apply it to a couple places. One was Palomar Gateway in Chula Vista had plans to densify its transit station. I've cut most of the details out of this piece, but I think we all know where this is, or at least roughly. They had a plan to build out along the rail line. The market hasn't really kicked in fully yet to build their plan, but should that plan come to be, our model shows it would have it would result in a 68% increase in active walking, a 15% reduction in high blood pressure, and a 9.5% reduction in type 2 diabetes, roughly speaking. So some benefit to it. Lots of other things, but I think I'm gonna stop there and maybe scroll down to if I have a concluding slide. I guess the one slide that I will say before I stop is this was the Los Angeles. This I think is one of the highlights. They're going to invest or have been investing an earmarked $12.8 billion in active transportation over the next several decades. Should they actually do that? The health benefits we found using AECOM, which is one of the largest engineering firms in the world, built the cost benefit model used by Sandag and others It's called the REMI model, REMI Insight. Some of you may know of it, who are economists. An $8.41 payback is what we observe broken into these categories. So I'll leave you with that. And that becomes $100 billion saved through the life of their plan. And that could really matter. So I got to figure out how to stop sharing.
Fascinating. Thank you very much, Larry, for that interesting discussion.
Sure.
Those of you who have questions, please put your question in the chat or electronically raise your hand, and we will start with Rick Boland.
Well, thank you for that interesting talk. I think it's a very important issue. Not going to challenge that you were the first guy to get into this, or that the health issues weren't brought into focus by you. But the first book that I was assigned to read when I was in college in 1965 was William White's Organization Man. So
yeah, I know him.
Yeah, pop in anytime you want. And it was all about how to design the cities, to be walkable. And then a friend of mine, Richard Rhine, I don't know if that name sounds familiar. He wrote a book about White, which kind of brought all that back. And a lot had to do, and he lives in Princeton, and a lot was how to design Princeton so that people would be encouraged to walk into town, not use their cars and all the rest of that. I don't think anybody back then focused on blood pressure and weight and all the rest of that. Of course, everybody was skinny back then too. But it's just an interesting thing that goes back, 60 or 70 years. The thinking about this kind of thing and how to design the cities and also there was a lot of talk in Rhine's book about how to have chairs and patios and that kind of thing around big buildings in places like New York City. I wonder if you could comment on that.
William White created what became known as the Project for Public Spaces, and it actually got me interested in planning. He was interested in the socialization. If you ever see, as I show the video sometimes to my students, where he takes a couple different, he loved Paley Park in New York City. It was a little space. He would talk about why certain spaces were more inviting and appealing to people. So he was more interested in the social aspects. But science moves on, and you're able to take metrics and start to measure and show. It was all thought to be initially fairly qualitative and not as measurable as it actually really is. These relationships are rather systematic, and that is not a bad thing for public policy.
Yeah, well, in Rhine's book last year, he talked some about how in New York City, they were, when you put up a new building, you had to put a certain amount of open space there, and then you had to have chairs in there. And some of the places took away the chairs, and fewer people walked and fewer people used it. So it was, there was a whole lot of detail about how to really make that happen.
Yeah, well, one way to make it happen is to monetize the health impacts and show that it's cost effective. That's what there's anyways, complicated stuff. So other questions?
Other questions? While you're thinking, I will pose a couple. You said we are anticipating a lot of changes in Mission Valley. You didn't imply whether they were going to be positive or negative from your perspective and based upon your research. Could you further clarify and also comment on why Sandag perhaps has not followed where some of the research might optimally lead?
I'll take the first question. It's been in the paper and widely known that large land assemblages in Mission Valley have recently been sold and turned over, including a large mall. Major development companies wouldn't do that if they didn't plan on doing something with the land. So it's very prime, very central land in a very rapidly growing region that has a rail line right through the middle of it. There are, in fact, where people are able to build anything that is less car dependent and walkable, it sells immediately. There is an unbelievable latent demand, but what we have is an enormous institutional constraint. So maybe through regulation and lots of problems and reasons. Governance may be part of it only, but culturally, historically, and I guess I'm answering the second question, is the region has, had a very conservative base, the military in particular. So there's a whole ethos. It's not LA, it's not San Francisco, and even Sacramento, which would come the closest in terms of, fairly conservative, assumed to be somewhat conservative, has, at least in terms of governance, some greater ability, at least in this area, to activate more. We seem to be, from the appearance of what I've seen, elected officials or anybody, we watched Todd Gloria and former county council, what was his name? He recently had to step down. He was the head of Sandag board, and he was, anyways, all the elected officials shy away from even discussing any kind of taxation on road use charges. And these are the kinds of mechanisms that in other regions are being used. So we're really stuck. The leadership isn't there. Anybody who's an elected official doesn't want to touch it because it means they won't get voted into office. So it comes down to education and the public. And one angle would be, possibly UCSD as an educational institution could take a leadership role and say, hey, how serious does UCSD want to make the climate targets for the region part of its mission? It could, because it is a state institution. So it's possible the university, what other institutions big enough? But right now we're in a kind of a leadership vacuum. We have tremendous, I would say tremendous, compared to other states, very strong regulatory and policy and incentives at the state level. But San Diego doesn't, and federal level, but San Diego doesn't seem to be able to move on it. Any other questions?
I have a few more if people want to stay online, and perhaps other questions will emerge. Why have certain neighborhoods evolved with no sidewalks, which certainly discourages walkability? Was there a reason behind that developmentally?
Sure, they let a developer build it without sidewalks so they could make more money.
I see. No other reason than that. Okay.
I don't know. I mean, there wasn't the vision of why it was important. The mentality, the framework, the psyche, the lens through which the planners working at the time on that were thinking is purely, no one's ever going to walk here, so why should we build any sidewalks? Well, that's what you call a self-fulfilling prophecy, right? We're good at that,
right?
So that's
right.
So why would and if you do that, but if you do the opposite and you say, well, the first few people in an area that have to build sidewalks are like, why should I do it? But then you require it in any new development. You slowly over time create a place, and then maybe you put some trees in there and maybe a bench. So
right.
Transit. Yeah.
In the post-COVID era, some of our cities are described as dying. I mean, we all know the stories about San Francisco, and we all know our personal experiences in visiting San Francisco. We also know the increased homeless population, and that is experienced by many cities. What does your research say about possible solutions to the changes in inner cities and the homeless population during the past several years?
That's really very good and very complicated question, because it, of course, and it gets it probably a good place to wrap up on, is the social environment, the demographic mix. Where right now the places that are the most walkable and that have the best tree canopy, green space, of course, are shot up. So we undersupplied walkability so effectively for so long that it's now, before, the walkable stuff was really cheap. And we'd look at it, people would be like, well, that's great, but no one wants to live there. Well, that changed. It became extremely bankable. And now even more so. So with the displacement of the lowering, as we invest in infrastructure and along the rail lines and start to do that in many cities, the displacement is terrible, and you're ending up with poverty in outlying areas, much like more Brazil or Europe, or other, maybe more like Brazil, perhaps than most. So, the favelas, outlying, and that's, that's the worst situation. So maybe I'm trying to think about how your question was framed. What becomes clear from the research and from what I'm learning from the work of many other researchers, this research and others, is that we have a profound responsibility to do our best to try to educate the public of the cost, the true cost. I think we did such a good job externalizing the health and environmental costs of the way we built our cities that people believe those are the real costs. And the externalities are the distortions that we're seeing now on our climate and on our health. And to get people to understand that connection, maybe one solution is healthcare providers. Kaiser. We work with Kaiser. Well, if Kaiser were to shave 3% off its annual cost, the amount of, what that would do is enormous. Kaiser should really care. They're, getting, informing people who are Kaiser members who make decisions about where to live, having that understood better about the health impacts of where they live and the costs coming back. Employers who pay healthcare costs. You try to think about who has a vested economic stake in the way we're building our communities. Lending institutions. There's been a lot of work on what's called location efficiency. So trying to make it cheaper to borrow money to buy a house. If you buy a house in a more walkable place where your transportation costs are cheaper, you can spend more money on other things, like you could have potentially a bigger mortgage and you could afford to live more centrally. I think the last thing we're trying to do now, maybe mention, is to combine the cost of housing, health, and transportation spatially. So you can think, if you live further out, your housing costs go down, your transportation costs go way up, and your health costs go up too. So if you throw the health costs into the housing and transportation question, which are inverse, the more central, you pay the most for housing, transportation's the cheapest, further out. So that relationship seems to be understood. I don't know how effective we are at dealing with it, but if you were to throw the health costs into that spatial arrangement of policy frameworks, that seems to me I don't know, I'm curious what others think of that. That's kind of a thing we're trying to.
So just to think about San Francisco a little bit, given that many of the storefronts have been vacated, so just in terms of revitalization, the implication would be to build high rises including low-income high rises to provide housing in walkable neighborhoods that would address the housing crisis for some, certainly not all, and also maximize health benefits of a 10-minute, 15-minute walk environment.
Yep. You'd have to create a bond mechanism or create the enabling legislation at the state level for bonding projected healthcare cost savings and leveraging that into development. I bet the state of California could figure out how to do it if the political will was.
Right.
Yeah.
Wonderful. Any final questions? If not, I would like to thank Larry Frank for a very provocative discussion, very enlightening, and certainly has given us a lot to think about in our environment and where we live. Thank you so much.
Thank you for the opportunity. I appreciate everybody taking the time to listen. I really, really appreciate it a lot.
Thank you.